As you know, my name is Dr. Michele Lee. So I'm actually a full-time ophthalmologist in Scottsdale, Arizona, just across town. I specialize in cornea surgeries like corneal transplants and cataract surgeries, and I do LASIK and PRK. But on the side, I'm also a physician advisor at MedSchoolCoach, where I love mentoring and helping pre-med students like you get into your medical school of your dreams. But before I did all of that, I was actually a professor at the University of Washington, where I served on the admissions committees for both the medical school as well as for the ophthalmology residency program. So given all that experience I've had interviewing, listening to good and bad interviews, I feel pretty qualified to tell you that I've learned what really makes a medical student or pre-med student stand out in their medical school interviews, and that's what I'm going to share with you today. So I'm just going to start off with some really scary statistics, and I promise that you'll come out feeling a little bit horrified by some of these numbers, but this is just the reality and what we're facing when we're applying to medical school. So in the 2022 to 23 cycle, there were over 55,000 applicants and only 22,712 matriculants in medical school. So what that means is that 60% of applicants do not get into medical school. So you might be wondering, what does it take to make it through? So let's back up. I want you to think like an admissions officer. So if you had thousands and thousands of applications to medical school, how are you going to stand out from the rest of the pack? Everyone has the same MCAT, GPA. What are you going to do? So first off, there's a few screening criteria that pretty much every medical school is going to use to kind of filter out your application. So obviously, they want to make sure you can handle the stressors and rigors of medical school, so they're going to use your GPA and MCAT kind of as screening tools to make sure you can handle the work. Next, they're going to really want to know if you actually want to be a doctor. I've read so many personal statements where it's very clear that they're doing it for the wrong reasons, or they don't really know what it takes to be a doctor or what the career entails. So we're looking at things like the personal statement to know what your narrative is, why you want to be a doctor, as well as know if you've done enough clinical experiences and research to really understand what it takes. Shadowing is a great way to kind of understand what the rigors are on a day-to-day life of a physician or surgeon. And then also, does this person have a unique perspective? Are they bringing something or selling something unique to the medical school? So the biggest challenge that my clients face is trying to figure out what makes them different from everybody else. So what makes them different from the person sitting next to them? And that's actually one of the hardest things that we do as MedSchoolCoach advisors, is try to figure out what angle or what theme, what hook, what is special about this applicant that we're trying to advise. And I promise that everyone here has something that's different or a unique perspective. So that's what I want you to take away from this talk today. So first off, I want you to start by thinking about your experiences, your accomplishments, and your goals. What are you selling to your medical school? So for example, I had a client last cycle who came in saying, I'm just an average applicant. I've done some research, some clinical, some shadowing, some community service. I don't know how I'm going to stand out during the application cycle. So we sat together and looked at his activities. So his main activities were that he volunteered at a student-run health clinic. He volunteered at a county hospital, but he was also involved in a global health advocacy organization through school, where he actually met with a representative to advocate for global health funding. So we decided that his theme was that he was going to be a voice for marginalized populations. So we incorporated that theme throughout his application and interviews, and he ultimately got into his top choice medical school. So I want you to find something that kind of resonates with you, a theme that you can catch, that you can incorporate in your interview as well as throughout your applications and secondaries. So once you figure out your theme, you also need to create a cohesive narrative. My experience is that applicants are great at kind of gathering different experiences, but they have a really hard time putting that all together. So that's something that you definitely want to do. You want to make sure that you're telling a story. You're not just kind of outputting a bunch of experiences without a narrative or without a story arc. So let's kind of go into the meat of the talk, which is the interview. So once you've set in your primary applications and the many, many, many secondaries that you're going to complete, I hope that some of you or most of you get at least a few interviews. And the interviews is really the time where you can shine and really show your personality and your individuality. So definitely make sure you're prepared and get the most out of this experience and show what your worth is to that school, what you're selling to that school. So the good news is that once you've reached the interview stage, you know the school really likes you, and there's actually quite a high chance they'll accept you. Your goal here is really to try to show that you are who you are on paper, as well as show that there may be more to you than what meets the eye. And the bad news is that if you're not prepared, you can severely damage your chance of getting into that medical school. So the most important thing that you can do during your interview day is to sell yourself without coming off arrogant or rude. Make sure that you're extremely polite to everybody, including any admins or anyone that's coordinating the interview for you. And make sure that you always send thank you notes. I like to send emails if possible. They just get to you fast, more quickly than a card. And just make sure that you are putting your best foot forward. So almost all the schools this cycle are going to be offering virtual interviews. This may or may not change in the future. When I interviewed for medical school 15 years ago, we had to do in-person interviews, spending thousands of dollars flying around the country, spending full days touring, meeting with everybody. And while there was some benefit to that, I think it's actually kind of nice that you have the option to interview in the comfort of your own home. But what that means is you have to optimize your interview environment. So you need to make sure you find a very quiet room, you check the audio, you check your mic, you make sure you have everything optimized. I've seen some very distracting backgrounds when I've been interviewing, so make sure you just have a very clean background. A white wall is more than fine, otherwise just nothing distracting. You also want to make sure you have good lighting, so having a ring light or sitting by a window would always be good. Just make sure that you don't have too much backlight coming, otherwise you're going to look like you have a shadow. So for most applicants, the interview is actually the most frightening part of the whole experience of applying to medical school. And I promise you that even if you have crippling shyness or social anxiety, you can come out appearing confident and really putting your best foot forward by practicing. So I actually think the best thing to do first is to start by practicing with your family and friends, people you feel comfortable with, just so you can just practice doing an interview. And then when you're ready, seek out mentors or professional advisors who can give you basically just some impartial feedback about your performance. And it's really important that you continue to practice, get feedback, and make sure you're incorporating that feedback every time you do your interview prep. So that way, every time you do it, you're getting better. So at least 1% better each time you do an interview prep. All right, so these are some of the common traditional questions that you're going to get asked during your interviews. And you should definitely make sure you are prepared for these questions. And I also encourage that you go through the list of questions that you can find online, and then just make sure that for every question that could potentially be asked of you, that you have at least an idea of how you want to answer them. But if you're going to just prepare for 2 questions, I want you to start and end the interview strong. So let's talk about the most common opening question and the most common closing question. All right, so when I was interviewing for medical school and residency and fellowship, pretty much every interviewer asked me to tell me about myself, and I always wondered why they were asking that question of me. But when I started interviewing myself, I realized why. A lot of times the applicants are completely new to the interview, or either it's a closed book application, so they don't know anything about you except maybe your name and how old you are and what school you went to. Or they read your application, but they also read 20 other applications that day. When I was interviewing for ophthalmology residency, we'd interview 25, 30 people in a day, so I kind of got everyone mixed up. So tell me about yourself is actually more for the interviewer to kind of refresh their memory about you. So I actually think you need to use this question in order to give your 60-second elevator pitch, highlighting everything you think that the interviewer needs to know about your application so that they can then, proceed to ask about anything that they're interested in. So for example, I know you heard my bio, but this is kind of what I would say if I were interviewing for medical school today. So I'm originally from Los Angeles, California, and growing up, I was a concert pianist until I developed an eye infection that took me to the emergency room, where I was told I would lose my vision and need a cornea transplant. But through my positive experiences with my ophthalmologist, I fully recovered my eyesight, and also discovered medicine as a possible career path. I've always enjoyed the sciences and medical research, as well as helping people through my volunteer work at hospitals and nursing homes, so a career as a physician seemed like the perfect fit for me. That's why I'm here today. So here in this pitch, I've highlighted some things I think the interviewer needs to know about me. So my hook, something that's unique about me, that I'm a concert pianist. So when they're talking about me on the AdCom, they're going to say, oh, that concert pianist, or that girl who played piano. My story, which is that I switched careers after I had my own medical issue with my eye. And I think if they're interested, they'll ask me more about that and get some more information about that. And then I also highlighted some of the experiences that they could potentially ask about. If they're interested in research, they can ask me, oh, it sounds like you did medical research. Tell me more about your research. Or tell me more about volunteering in nursing homes and hospitals. Tell me about a patient you remember. And then I kind of at the end tied it into why I was there interviewing for medical school and why I wanted to be a doctor. So I kind of like the tell me about yourself question, and you definitely need to memorize that 60-second pitch and be able to just say it many, many times. You shouldn't even think about it because you know that's going to be the first question they ask. Now, if they don't ask you, tell me about yourself, if they open up with, hey, so why are you here? Why do you want to be a doctor? You can still use this tell me about yourself pitch. In fact, whatever first question they ask, try to incorporate your tell me about yourself pitch, because again, you're trying to sell yourself to the medical school. You want to show what you can bring. And basically the tell me about yourself is the fastest way to do that. And another really big mistake that I see applicants do when we're prepping for interviews is they don't prepare for this question. Any questions for me? This is to them a throwaway question, and they'll start rambling about curriculum and specific classes or specific clubs. And I want you to step back and think about who's interviewing you. Most likely the person on the AdCom is not the Dean of Medical Education. They are a clinical professor or a research professor who spend most of their time doing other things and maybe volunteer a day 6-7 times a year to interview medical students. So they don't know anything about the curriculum, the clubs, the first year. So you don't want to ask questions that they can't answer, because that makes for a very awkward end of the interview. And you want to end strong. So instead of asking nitty-gritty details about the curriculum, you want to maybe turn the interview around, have a conversation with that person, because that person there had made it. They're a doctor, they are in academics, they're most likely a professor on either a tenure track, or they have research or clinical. They have something going on. They have something that you can learn from. They pick that school to either go to school at or work on. So you can open up with something like, I'm wondering how you decided to start your career at this medical school, or how did you end up at this medical school? And that's a great question to kind of open with so that you can start a conversation. And this is a great time to show that you're an active listener. So don't just ask the questions, have follow-up questions, listen to what they're saying. Why did you choose this field that you're in? How did you decide to go into research and not clinic? Maybe you can learn something about that person. And even though it's not about you, and I know you're there to interview for medical school, but even though it's not directly about you, you're learning. They're feeling great about talking about themselves and their accomplishments. And at the end of the day, it makes for a less awkward ending than just asking a bunch of questions that they can't answer. All right, so a lot of clients also tell me that amongst the whole interview process, they're actually the most nervous about the multiple mini interview, or the MMI. And I get it. This is less common, or it used to be a less common interview format that's extremely difficult to prepare for, because you never know exactly what kind of questions you're going to get or what kind of activities they're going to make you do. But this is actually being increasingly used in medical schools. About 50% of schools are now incorporating the MMI either within a traditional interview or separately as a separate interview. So this is definitely something you need to prepare for and at least have a strategy for. So the reason why they're incorporating MMI is that most of your application, everything else that you've done, has been based off of academic success. And when they're looking to accept someone from medical school, they're accepting future physicians. And there's just more to being a physician than just being book smart. You need to be empathetic. You have to have good communication skills, problem solving, critical reasoning. So schools need to find a way to assess that. So I know it's frightening. MMI is always very frightening to my clients, but honestly, I think MMI is a good thing because if you are a relatively normal person, you're going to do better than most people. And also MMI, you have 6 to 10 stations. So that's 6 to 10 opportunities to excel. Whereas with a traditional interview, you're usually with 1 or 2 people. If you don't jive with someone, that's at least 50% of your interview down the drain. Whereas with an MMI, you have 6 to 10 opportunities to shine. So there's actually more opportunities to excel. You can think of it that way. You bomb a room, that's okay. You can still get into that medical school if you do well in the other rooms. So the first tip I have to ace the MMI is communicate. Communication is the key to success here. So for example, let's go through a sample MMI so we can kind of demonstrate why communication is so important. So if you have the choice of giving an organ transplant to either a successful elderly member of the community and a 20-year-old drug addict, how do you choose? So when I give this question during mock MMIs, 90% of the clients will just jump into a conclusion. Like, I wouldn't give the transplant to the 20-year-old drug user. I would give it to the successful elderly gentleman. And if you do that, you're really not doing your due diligence for this question. You want to be able to ask follow-up questions and get some more information about the 2 patients because they're putting labels here, but these are not labels, these are patients. They have a story. You need to find out more about, for example, the 20-year-old. You need to know about their drug status. Maybe they've been clean for a long time. Maybe they were dealing with mental health issues that have now resolved. Maybe the elderly patient has a lot more comorbidities. And basically, you're just trying to find out who would get the most out of that transplant. So for example, a better way to approach this would be to start by clarifying what's going on, clarifying what they're asking of you. So you can start with something like, from what I understand from this scenario, I have to make a choice between giving an organ transplant to 1 of 2 patients. This is a very difficult decision, and I would need more information to help me make my choice. And then you can ask your follow-up questions and clarify and communicate your thought process. It's not about the answer. Actually, ultimately, they don't really care about your answer. They just care that you're asking the right questions and communicating your thought process. So when you approach any MMI, whether it's an actor patient or one of these scenarios or a challenging question or even teamwork, it's really all about communication. So as you can also see, not only communication, but you need to make sure you're clarifying the situation. So for example, when you have your actor patients, because a very common MMI will be an actor that is either a difficult patient or someone you have to share bad news with. And you are being evaluated on empathy and communication, but you also need to make sure that you're actively listening and make sure you're asking those clarifying questions, because sometimes those actors are given some information that you need to get from them, and you can only get that by actively listening and asking the right questions and clarifying things. So sometimes there's a little trick to some of these actor patients or even these scenarios where you have to kind of dig deeper, make sure you're listening and actively engaging as you're going through the MMI. So the best way to prepare for the MMI is honestly just to practice. Go online. You have so many different practice questions that you can go through, maybe go through them with a friend, give each other feedback, and then when you're ready, I actually think there is a lot of value of getting a professional to give you advice about how you're doing so that you know what you need to work on. So basically at MedSchoolCoach, we kind of do everything. We do everything from advising when you're just trying to decide if you should go to medical school, to interview preps and everything in between. So if you feel like you're struggling with interviews and you need some more practice for traditional or MMI, or you just need some advice, you can always let us know. We give free consultations, see what you need, how we can help you. I would say the most popular thing that we see is that a lot of people right before interviews will solicit feedback for interviews and do interview prep, and that's something that we do all the time. So happy to have you sign up for a session if you feel like you could use some feedback. Otherwise, I think that's it for the end of my talk. If you have any specific questions, I'll be around the MedSchoolCoach booth afterwards. I'm happy to talk to you and help however I can. And thank you very much for having me.